Hi, everyone. My name is Ellen Orsi, and today I'm joined by my colleagues Noelle Baker as well as Nicole Loafman. We're going to be talking about mindfulness based stress reduction, or MBSR. I appreciate everyone's time. I am a huge proponent of this program. I've actually participated in two courses myself, one at UVA and one at UMass. And I plan on going on for teacher training one day and hopefully incorporating this into my own practice. I've gotten to experience, some of the changes it can create in your life, both firsthand as well as gotten to observe it in others. So I really hope that by the end of this presentation, you are also excited about MBSR. So MBSR was founded in 1979 by Jon Kabat-Zinn. He first was teaching at the University of Massachusetts in a stress management clinic, and he was also a professor within the medical school. He studied molecular biology at MIT, but what makes Jon Kabat-Zinn unique is that in addition to having, this really formal biological background, he also studied Buddhism and Eastern philosophy and religion under Thich Nhat Hanh, who is one of the most famous Eastern Buddhist philosophers of our generation and time. So I think that really had a huge impact on him and what he went on to do in creating MBSR. So at the foundation of MBSR is mindfulness, and mindfulness in the easiest terms can really be thought of as coming at the present moment with curiosity or neutrality. You can think of it as observing the present moment with, much like a wave and ebb and flow, and watching that ebb and flow of thought with non-judgment. In the words of Jon Kabat-Zinn, mindfulness is awareness that's developed by paying attention on purpose in the present moment. And, we've talked a lot about therapeutic techniques and kind of what they focus on. And, we've talked about past, present, and future. This therapeutic technique is truly focusing the most on the now and the present moment. There are kind of multiple components of MBSR. So MBSR, like I said, started out of this program with medical students under Jon Kabat-Zinn, but today it's really evolved into a lot of other practices. However, MBSR at its core is the most popular. But what it is MBSR is an 8-week program, and every single MBSR course is pretty much the same, and that it's a very formal process. So you have an 8-week course where you meet one time a week for 2 hours with an instructor in a group. There is a full day silent retreat component, as well as required individual practice. And so MBCT, or mindfulness based cognitive therapy, is a very similar approach. It has the same, setup, but it was developed to treat depression, and research has shown that it's very effective in preventing relapse in people who have recovered from depression. So it's a great supplement to traditional talk therapy. And it has been clinically proven to, help reduce recurrent depression. It incorporates a lot of therapeutic techniques and ideologies from cognitive behavioral therapy. In addition to MBSR and MBCT, there are other programs that have been born out of MBSR, including pain management, eating disorder management, and a whole slew of others, which we'll talk about later in some of the things that MBSR is very useful in treating.
So the goals of therapy. Ellen gave us a very in-depth explanation of the foundation of MBSR, and I'm going to look a little bit about the application. As Ellen mentioned, the goal is to manage stress, chronic pain, mental health concerns. When it was first developed, the goal was to find a way to manage stress, particularly in the medical students that were being seen. The focus of MBSR, as Ellen said, it's a kind of behavioral therapy. So it's more about shifting perceptions than eliminating the issues, about changing your mindset. And it is often used to supplement other therapy approaches, though it can be used on its own. The therapeutic relationship, as with pretty much almost all therapeutic approaches, you do want to have a strong relationship. When you're looking at something like mindfulness-based therapy, you need to trust. You need to be able to relax. You need to be able to reflect. The trained instructors lead 2 to 3 hour group sessions once a week for 8 weeks, as Ellen said, very structured. So the participants need to feel safe, need to trust the leaders in order to be able to let the change happen. In addition to just the common sense about feeling that the therapeutic relationship is important, research has found that instructor ratings correlate with changes in depression and stress. The the study that we have cited here, which is also in the references at the end, looked at 18 different research-based studies, all of which did show different connections between the importance of the instructor and the benefits of the MBSR program. There are many techniques within the main three. Mindfulness and awareness exercises and yoga are really the two main approaches with MBSR. We have listed here a number of the different mindfulness exercises, and later on we're going to show you a demonstration of one of the mindfulness exercises. As far as yoga and meditation, these are more chosen by the leaders based on responding to what the individual and the group need, but all mindfulness-based stress reduction programs are going to include mindfulness and awareness exercises, opportunities for yoga and meditation. And on the next slide, Noelle's going to go over a little bit some of the techniques and skills.
So mindfulness really is about using your breath or an object as an anchor. So that means you're going to return your attention to either the flow of your breathing, and feeling your stomach, or an object such as like a raisin, I think was an example of one that's used in the formal mindful eating practice that Nicole just mentioned. And so when the mind begins to stray to the past or future events, that's a kind of technique using those two things, a breath or an object, to refocus. Also, the therapist or instructor will use audio recordings, or they will give audio recordings of the guided exercises so that this practice of mindfulness can continue outside of therapy or outside of the group sessions, so that it can continuously be practiced. And even during mundane tasks like cleaning or driving, you can practice this because it's not a task that requires a lot of your focus. So you can also focus on challenging your habitual thinking of thinking about the future, what you're going to make for dinner or anything like that, or you're going to go on vacation. It's just bringing you back to that present moment. And another thing that a therapist can give as a way to encourage practicing outside of these formal sessions is homework journals or worksheets.
One of the things that we keep coming back to, mindfulness-based stress reduction isn't just mindfulness. We hear a lot nowadays about incorporating mindfulness into our lives and to relaxation, but mindfulness stress reduction is actually a structured 8-week program. And this comes from the University of Massachusetts. We took a description of the course and put together what the focus is each week and sample strategies and then use of the strategies. So you see that it moves from introduction, looking at your perspective, formal practice, and then starting to move into improving concentration. As Noelle said, applying the strategies to your daily life, resilience, applying the awareness to your functioning outside of the outside of the sessions, integration, bringing it into your daily life throughout the day, and then finally closure, giving people the tools to continue using what they've learned in the program in their lives once they've left the program. Therapeutic applications, mindfulness-based stress reduction. Originally designed for stress management, as we noted by the professor at the school. Again, this all comes from a study that is also listed in the references at the end. The demonstrated additional effectiveness improving the conditions of patients. So obviously, somebody with HIV/AIDS, somebody with diabetes is not only going to be using mindfulness-based stress reductions, but the research studies that are cited in the article that we have talks about the fact that when they looked at people being treated for disorders and illnesses such as these, who were getting the regular treatment combined with mindfulness-based stress reduction, did see improvements above those who were doing it without.
So like already has been said before, the contribution of the approach is it's a very structured way of practicing being mindful is these sessions. And this way it can be evaluated whether it's really effective for whatever it is targeting against, whether it's one of those medical conditions that we've mentioned. It's an evidence-based practice. There's been many studies to support it. And it's effective treatment for a variety of psychological disorders. And this is a list here, kind of show you how many it's beneficial for. Not beneficial for all, but quite a number of different disorders. And these exercises are fairly simple to apply, even though it can be difficult at first learning these exercises or learning how to be present in the moment when it's such a pattern for us to not always be in the moment. So but yeah, these exercises don't have to be just performed during those sessions. They can be taken anywhere and applied and integrated with other approaches.
And as we kind of get ready to start our demonstration of this therapeutic approach, I wanted to also mention that one of the benefits of why it is so formal is that it has been peer reviewed and studied that it has an effect on neural pathways. And you have to do the exercises like riding a bike or lifting weights. You have to exercise the muscle to create those neural pathways. So as we move into the demonstration, I want to mention kind of what we're going to see. So mindfulness really has two parts, and MBSR is broken into those two. There's informal practices, that's, being mindful in the everyday, as we've mentioned before, potentially during cooking, cleaning, eating, etc. And then formal practice is MBSR, the program regimen. That would be, sitting meditation, yoga, walking meditation, and so on, where you're, formally practicing those. And so up next, this is a really typical MBSR demonstration. It's just been condensed into 5 minutes. Formal classes typically would be about 2 hours. And it's structured with a discussion beforehand, explaining what you're about to experience. Then there's an exercise and practice followed by a debrief session.
Could be when you're washing dishes or eating a meal.
Okay, all right. So when I'm washing the dishes, if I am focused on the task and I'm not thinking about tomorrow, or I'm not thinking about the day, and I'm absorbed in that activity, that could be an example of a mindful practice.
Exactly.
Okay. Let's try one of the formal things.
So let's give it a try. We'll do a short practice. We'll take about 3 minutes.
Okay, all right. Do I have to wear any special clothing, or I didn't bring my yoga clothes. I don't have any yoga clothes.
Well, good thing you didn't bring any then.
There you go.
So we don't need anything special to do
Okay.
this practice. We already have everything we need. So all we'll need to do is just take a comfortable position to give it a try.
Put both feet on the floor.
Usually, yes, to uncross legs if they're crossed, to really take a minute to settle into the chair. And you don't have to be sitting for these practices either. People often lie down on the floor or on a comfortable surface, or they stand if they prefer, maybe leaning against a wall. All of those are okay.
Okay.
The point is to be both relaxed and alert, to pay attention to what we notice. Once you've found a comfortable position and made any of those needed adjustments, perhaps letting your eyes close or taking a soft gaze down at the floor in front of you. The reason to do this is just to help minimize distractions and allow your brain to focus on the sensations of the breath. Knowing for this time, there's nothing else that you need to do. Nowhere else to be. No one else who needs you. Maybe taking a conscious deep breath in and out through your nose. And then just letting your breath be exactly like it is, and directing your attention just there. Noticing where you feel it in your body now. For some folks, it's feeling the air moving in and out of their nose. Other people may feel it in the rise and fall of the chest, or maybe in the movement of the belly in and out with the breath. Just seeing what's true for you. No need to change anything. Perhaps as you're paying this kind of close attention to the breath, noticing the in-breath, that short pause, the out-breath, short pause, and then the breath begins again. When your mind moves away from focusing on the breath, know that you haven't done anything wrong. That's the natural state of the brain. Congratulate yourself for noticing and bring your attention back like you'd welcome a friend to your home. If your mind feels particularly busy this morning, perhaps counting the next 10 in and out breaths to yourself. As you're ready, getting ready to end this short practice, taking 2 or 3 deeper breaths again, in and out. Ending your practice and bringing your attention back. Thank you. What did you notice from just taking those couple minutes to do that practice?
You know, I noticed a few things. The first thing I noticed is that when I first started, I actually felt more anxious, and my mind went to all the things that I need to do and that I'm not doing. And I don't think that's what I'm supposed to do. Did I do it wrong?
Not at all. You did it exactly right. And that's a very common experience for folks, especially people who are so busy and serve others
Mm-hmm.
all the time. We're always thinking of the next task that needs to be done, and to pause can be really uncomfortable.
Right.
That's okay.
Okay.
That's part of the mindfulness practice, to notice what our thoughts really are and what our sensations are, and how those thoughts are actually taking us away from what's happening right now
Okay.
in the moment. We
So
don't
then
have to change that at
Okay.
all.
I have had the chance to do this before. And so, you know, practicing on clearing my mind of those thoughts helped me then go to a deeper level of peace and calm internally.
That happens for many people. And what I would say is, even there isn't any need to consciously clear your mind of those thoughts. What I would say is just, you notice those thoughts. Perhaps you even take a moment to name them to yourself. Worry, discomfort, anxious. And then you come back to the breath. And it's that fact of actually accepting them instead of trying to clear your mind or push them away that allows that deeper calm and settling in, and the peace that I think you found next.
Right, right. I think that is what happened next.
So we just saw the demonstration of mindfulness-based stress reduction. Like I mentioned, a typical course would be 2 to 3 hours in length, and that was just an abbreviated portion. But I think the big takeaways were, the client mentioned, that he was a bit more anxious at first, followed by relief. And so it's really important to note that this practice can sometimes take time to be rewarding and see its effects. As I mentioned before we watched the demonstration, this practice quite literally changes your brain by creating new neural pathways around stress management. So it can take a few weeks before you start to notice some of the results, but everybody is different. I also wanted to note that video and demonstration came out of the Department of Veteran Affairs. They've done a lot of research as well as contributed funding to the efficacy of these programs.
So the contribution to multicultural counseling is that MBSR is very flexible. It's become more secular. It's a non-judgmental practice, and it really has a goal of acceptance. And it is accessible to all people, regardless of their religious traditions or beliefs. And it's really relevant to culturally diverse clients. The limitations to multicultural counseling is it has those origins in Buddhism. It's an individual practice, so it really takes looking at your internal or your own experience rather than a group. There's a technology requirement. You need to have access to a computer so that you can listen to those recordings or watch those guided videos. And it's a cognitive, it takes cognitive effort. And if you have a cognitive disability of any kind, it's going to be much harder to practice, not impossible, but more difficult. Some limitations of just the approach itself is that their access to formal MBSR courses may be limited due to monetary barriers. It's very regimented, so someone who may not want such a structured Therapy might not benefit from this. It's a short-term program. So once those weeks of MBSR are over, then you have to kind of take responsibility for continuing to practice mindfulness. And it does not address deeper problems, rather provides a way to cope. So it can act as a distraction to things that are of more importance in life for you. It's also a form of mental discipline. Like I said, it's cognitive, it takes effort, and it also takes commitment to routine practice to really reap those benefits for the brain to change, as Ellen mentioned. And like we saw in the demonstration, it can cause anxiety at first because you're really going against our natural inclination to want to make sure we're checking off all the things on our to-do list and and thinking about others. Some more contribution of this approach is all the benefits. It's a coping strategy. It can help, like if you're avoiding emotions, it can help you to allow yourself to feel because you are able to reduce the amount of reactivity that you're having to those emotions or exasperating symptoms. Helps manage pain. It improves focus. You can concentrate because of all that you need to concentrate and pay attention to what's going on around you and inside of you. It's also relaxing. It's a good preventative measure of of when something stressful is coming up. If you are in a more state of calm before that event, you're going to be able to have quicker recovery. You're going to not become burned out if you're a teacher or if you're a student, college student, having a rigorous course of study.
And so finally, before we close out, I included some resources here to some places where you can seek MBSR training for both becoming an instructor, or if you're just interested in taking a course. John Kabat-Zinn also has a number of books. However, Full Catastrophe Living is one of his most famous books. And yes, thank you to everyone who joined today. I really appreciate your time.